Welcome to the New England Journal of Medicine at the annual meeting of the European Society of Cardiology. I'm Stephen Morrissey, Executive Managing Editor, and I'm talking with Deputy Editor Jane Leopold and Editor-in-Chief Eric Rubin. We're looking at the inflammation, cholesterol, lipoprotein A, and 30-year cardiovascular outcomes in women study. This study asked whether or not markers of cardiovascular risk predicted outcomes over the long term. Jane, what did we know before this study?
Well, we've known for a while that high sensitivity CRP or C-reactive protein, LDL cholesterol, and lipoprotein A all contribute to both the 5-year and 10-year risk predictions of cardiovascular risk. And they all represent distinct pathways for pharmacologic intervention that we can target. What we didn't know is whether or not there was any utility of looking at these biomarkers over longer periods of time and over longer periods of time in women specifically.
Eric, what did the investigators find?
Steve, these researchers used data from the Women's Health Study, which is a longitudinal study that's followed almost 40,000 female health professionals since the early 1990s. They tested to see if the levels of 3 biomarkers, the ones we mentioned before, high sensitivity CRP, LDL-C, and Lp(a), were predictive of their primary endpoint, a composite of MI, coronary revascularization, stroke, or cardiovascular death. They found that each biomarker independently predicted risk and that the models that combined them all were even better at the prediction of the primary outcome out 30 years later.
So, Jane, how does having a 30-year risk prediction model benefit clinicians?
Well, this actually provides an opportunity for really early intervention. And in fact, if women don't pay attention to their cardiovascular health and cardiovascular risk factors very early on to mitigate risk, then they put themselves at increased risk of adverse cardiovascular events. And this is something that can be changed if they actually know what their risk is 30 years in advance. This study actually provides data to support that claim, and cardiovascular societies are actually buying into this long-term risk prediction idea. In fact, the American Heart Association actually released the Prevent Risk Calculator that actually assesses the 30-year risk of cardiovascular disease in healthy people. So the idea of looking, ahead 30 years is something that's starting to gain a lot of attention.
One of the really difficult things about doing a 30-year study, Jane, is that things change. And obviously, a lot of the measures that we use to reduce the risk of heart disease have changed over the past 30 years. So do you think that 30 years from now, the same markers will have the same importance?
Well, it's likely that they will, because from what we know about the biology of cardiovascular diseases, each of these markers targets a biologic pathway or represents a biologic pathway that's of importance to the pathogenesis of cardiovascular disease. So knowing what your risk is based on these markers and knowing that what your at least starting point is, you can actually see if you can modulate these levels over time and reduce your risk.
Thank you, Jane, and thank you, Eric. This study was just published at NEJM.org.